Welcome back. I'm Rachel, and in this video I'm going to go over the structure of the parietal bone. The parietal bones are located on each side of the head, extending up and over the top of the skull where they meet each other at the midline. If we take a look at the lateral view of the skull, you can see highlighted in red the right parietal bone located on the side of the skull. If we also look at the posterior view of the skull, you can see highlighted in red the two parietal bones that meet at the midline of the skull. Now we're going to look at the different landmarks and features of the parietal bone. Here we have the lateral view and the medial view of the right parietal bone. This bone consists of two surfaces. The first of these surfaces is the external surface. This surface is convex in shape and smooth. Near the center of this surface is a tuberosity known as the parietal tuber. This tuberosity is also known as the parietal eminence. Two lines run across the surface forming arches. These are known as the superior temporal line and the inferior temporal line. The area of this bone below these lines forms part of the temporal fossa, which is a shallow depression found on the sides of the skull. Along the superior border of the surface, there is sometimes a foramen present, known as the parietal foramen. The second surface of this bone is the internal surface. This surface is concave in shape. This surface has branch grooves on it for the middle meningeal vessels. Running along the superior portion of this surface is a groove for the superior sagittal sinus. Near this groove are small depressions known as the granular foveolae for the arachnoid granulations. A groove is also found on the infero-posterior part of the surface for the sigmoid sinus. The parietal foramen, when present, is also visible on the surface. This bone also has four borders. The first of these borders is the superior border, also known as the sagittal border. This border is both the longest and thickest of the four borders of this bone. It forms the border between this bone and the opposite parietal bone. The second border is the anterior border, also known as the frontal border. This border is highly serrated. It forms the border between this bone and the frontal bone. The third border is the posterior border, also known as the occipital border. This surface is irregular in shape. It forms the border between this bone and the occipital bone. The fourth and final border is the inferior border, also known as the squamosal border. This border is split into three parts. The anterior part of this border is short and thin. This part forms the border between this bone and the greater wing of the sphenoid bone. The middle part of this border is arched in shape. This part forms the border between this bone and the squamous part of the temporal bone. The posterior part is thick and short. This part forms the border between this bone and the mastoid part of the temporal bone. This bone also has four angles. The first of these angles is the anterosuperior angle, also known as the frontal angle. This angle is approximately 90 degrees and is formed by the junction of the sagittal border and the frontal border. This angle is found at the bregma, which is the area of the skull where the sagittal suture and the coronal suture meet. The second angle is the antero-inferior angle, also known as the sphenoidal angle. This angle is formed by the junction of the frontal border and the squamosal border. This angle is found at the pterion, which is the area of the skull where four bones meet: the parietal bone, the frontal bone, the sphenoid bone, and the temporal bone. The third angle is the posterior-superior angle, also known as the occipital angle. This angle is formed by the junction of the sagittal border and the occipital border. This angle is found at the lambda, which is the area of the skull where the lambdoid suture and the sagittal suture meet. The fourth and final angle is the posterior-inferior angle, also known as the mastoid angle. This angle is formed by the junction of the occipital border and the squamosal border. This angle is found at the asterion, which is the area of the skull where the parietomastoid suture and the lambdoid suture meet. Let's now take a closer look at the other bones the parietal bone articulates with. This bone articulates with 5 other bones. The first of these articulations is with the opposite parietal bone. The sagittal border of the parietal bone articulates with the sagittal border of the opposite parietal bone. This articulation forms the sagittal suture. The second articulation is with the frontal bone. The frontal border of the parietal bone articulates with the parietal margin of the frontal bone. This articulation, along with the articulation of the opposite parietal bone to the frontal bone, forms the coronal suture. The third articulation is with the occipital bone. The occipital border of the parietal bone articulates with the lambdoid border of the occipital bone. This articulation, along with the articulation of the opposite parietal bone to the occipital bone, forms the lambdoid suture. The fourth articulation is with the sphenoid bone. The anterior part of the squamosal border of the parietal bone articulates with the greater wing of the sphenoid bone. This articulation forms the sphenoparietal suture. The fifth and final articulation is with the temporal bone. The arched middle part of the squamosal border of the parietal bone articulates with the squamous part of the temporal bone. In addition, the posterior part of the squamosal border of the parietal bone articulates with the mastoid part of the temporal bone. These articulations form the squamous suture. What about the muscles that attach to this bone? A large portion of the temporalis muscle originates from the inferior temporal line. The temporal fascia is a layer of fibrous tissue that covers the temporalis muscles and attaches onto the superior temporal line. And that concludes this video on the structure of the parietal bone. I hope you found it helpful. Thank you for watching. If you want to support this channel, please subscribe and check out more of my videos.